Today we are going to be discussing about OET Reading Part A. All right, so can you tell me what you can expect in OET? OET Reading Part A. That is what we are going to be discussing today. And it is going to be a very, very interesting topic. So let's get on with the session. Now, I'm going to show you how an OET reading question paper looks like. Now, as you can see over here, this is an original OET question paper that has been created by the Cambridge University. So always remember that when it comes to your occupational English test, the Cambridge University, which is a British organization, along with Boxall Institute, which is an Australian organization. Both of these institutions together, they have made the OET examination, right? So it is very important that if you want to get your desired scores in OET, that you practice with the official OET study materials, right? Now, as you see over here, this is an OET Reading Part A question paper. So those who are completely new to OET, there are three parts to the OET reading. Now, as you can see, this is OET Reading Part A. And similarly, we have OET Reading Part B. And we also have OET Reading Part C. Right. So as you can see, we have three different parts, and every part of the OET question paper has its own unique features and challenges. So in today's session, we'll be focusing on the OET reading part A, right? And in today's class, I will be giving you a very important information that I would like to term as your intuitive trust skill. Now, what do I mean by intuitive trust skill? So here I'm basically talking about your intuition, right? See, your intuition, right? So what does your intuition basically mean? So intuition, we can say it is basically your instincts, right? So you have certain instincts, right? So that is your second nature. It is almost like second nature. Right. Now, when it comes to your intuition or when it comes to your instincts, it is very important that you are in a position to trust your intuitions. And this is extremely important for OET reading part A. Because you know why? In OET reading part A, time is a luxury you cannot afford, right? In OET reading part A. See, in OET reading part A, you have only 15 minutes time. You have just 15 minutes and there are 20 questions, right? And there are four different types of text. So we have four texts over here and there are almost 700 words, okay? And there are also three types of questions. Now, as you can see over here, the complexity keeps on happening. There are three types of questions, right? And there are four texts. And in those four texts, there will be almost 700 words, right? And there are 20 questions and you have only 15 minutes time. And that is why in OET reading part A, we say that time is a luxury that you cannot afford, right? So for example, if you have a lot of money with you, you can buy a luxurious car, you can buy a luxurious watch. But no matter how much money you have, when it comes to reading part A, you cannot basically afford time. So you should basically be in a situation to conserve your time. Okay. So your entire strategy over here, right? So the entire strategy in OET reading part A is basically time conservation as well as energy conservation. That is, you have to conserve your energy as well, because you need to understand that after you finish OET reading part A, you have to finish. So we have part A, we have part B, and we have part C. Right. So there are three parts to the occupational English test reading. So if you spend all your energy for OET reading part A, then you will have very little energy for OET reading part B and definitely very, very little energy for OET reading part C. So if you want to get really good scores in your part B as well as part C, it is very important that you conserve your energy as well. So this is where the intuitive trust skill comes, right? So if you are in a position to trust your instincts, okay, and if you have the ability to activate your intuition, right? And if you are able to have enough self-confidence and faith in yourself, right, along with really good strategies, then I guarantee you that it is going to be much more easy for you to handle reading part A, such that you will have time conservation as well as energy conservation. Understood. So in today's session, let's get into detail regarding the intuitive trust skills. Now, when you get your question paper, okay, so when you get your question paper of OET Reading Part A, this is how your question paper will look like. Now, what do you see over here? So we have one main topic. So what's the main topic over here? Managing diabetic foot ulcers. Yes, and as you can see over here, we have text A. Text A, the main heading over here is assessing a diabetic foot ulcer. Similarly, if you go over here, we have our second test. So what's the second text over here? So second text is called text B, and it has a heading, applying dressings to DFUs. Right. And now let's go to text C. So what do you see over here? So we have the third text over here, and it is debridement of DFUs. And similarly, we have the fourth text over here. And what do you see over here? In the fourth text, you see a table, dressings for DFUs and advantages and disadvantages. Right. So like this, you can expect four text A, B, C, and D. And below that, there will be how many questions? There will be exactly 20 questions. Now, as you can see, there are 20 questions, but there is a catch. You have just 15 minutes time. Right, so within 15 minutes, you have to find the answers to all the 20 questions. So over here, you are supposed to, okay, so your duty over here. So what is your duty over here? Your duty is to find the answers in limited time, right? And in a high pressure situation. Right. See, when you're in a high pressure situation, our mind, it is easy for us to become nervous, right? When we are in a high pressure, stressful situation, we become nervous, we become anxious, we become doubtful, we become fearful, etc. Right. Now, when we are experiencing all these types of negative emotions, what is going to happen? It is going to negatively affect our judgment skills, right? And that is going to affect your clarity. So you will have low clarity, and therefore it will be not easy to have accuracy. So you'll have less accuracy and you will get very low scores as well. Right. So this is what you need to understand about the OET. So your duty in OET is to find the answers in limited time in a high pressure situation. Right. So therefore, I'm going to talk to you about the first strategy. That is what I would like to call as your intuitive trust skill. Right. And for this, as you see over here, we should have a very calm mind. Okay, you must have a calm and a very clear mind. That is extremely important. Without a calm or a clear mind, our strategies are not going to work, because if you are in having these kind of negative emotions, then no matter how hard you try, it is definitely not going to help you out. Right. So all of you who are listening to this session, I want you all to first and foremost have a very cool, calm, happy mind. Right. Now, let's say that you have received your question paper. Right. Now, what you have to do is, okay, you have to come to the text over here. Now, what is the main topic over here? So the main topic over here is managing diabetic foot ulcers. Right, managing diabetic foot ulcers. So let's say, just type it over here. So here it is, the main topic over here is this one, managing diabetic foot ulcers. Right. So what do you understand by managing? Managing basically means what? Treatment. Right. So here we are it is very important that you have a little bit of synonyms. Okay. So let's use a little bit of synonyms. So management basically means what? Treatment. Okay. Or we can say handling. Okay, or we can say therapy. Okay, or all these kind of words. Okay, so these all things comes under the main topic over here. Right, so synonyms are extremely important. Now let's come to text A over here. Right. So let's see what is the main heading in text A. So in text A, as you can see, we have one main heading over here. So what's the main heading? Assessing a diabetic foot ulcer, right? So we have assessing a diabetic foot ulcer, and we have a table over here. So as we can see, there are three types of foot ulcers. So we have neuropathic, we have ischemic, and we have neuroischemic, right? And here in this column, we have sensations, necrosis, wound bed, and all these kind of things. So you just need to understand that in text A, they're talking about assessing a diabetic foot ulcer, and there are three different types of foot ulcers over here. Right. So you need to understand that in text A, okay, so what is the thing over here? Assessing a diabetic foot ulcer. Right. Now let's come once again with certain synonyms. Right. So what are some synonyms for assessing? So assessing basically means checking, right? Checking, or we can say evaluating. Okay. Assessing basically means checking, evaluating, finding out, okay, supervising, okay, all these kind of things. Okay, so these are certain synonyms for assessment. That means we don't know whether the patient is having diabetic foot ulcer or not. We are just assessing it. That is, we are checking for it, right? And there are three types of foot ulcers. So in text A over here, there are three types of foot ulcers of diffuse. Right. So this is what you need to understand. And this is the dedicated message. So we have four texts over here, right? So we have four texts over here, and all these four texts, okay, is having a each text. So you need to understand that each text is dedicated to one particular message, right? So here text A is dedicated to assessment, right? So this is very important because here I'm going to be teaching you about the intuitive trust skill, right? Now let's come to text B over here. Now what do you see B? What is the heading you see over here? So the heading you see over here is applying dressings to DFUs. Applying. So here it is application. Okay, so if a patient is having diabetic foot ulcer, okay, there are certain dressings and how we are to apply those dressings over here. And see, there is a, instructions for it, right? So text B, okay, so what do you see in text B over here? So text B is all about applying, okay, applying dressings to DFUs. Okay, so DFUs, that is diabetic foot ulcers, right? So what do you understand over here? Application. So we understand that it is application, right? The steps, okay, or the procedure, okay, or the process. Okay, the process, the procedure, the steps involved in the application of dressings to patients who are suffering from diabetic foot ulcer. Right. Now let's come to text C. Right. So what is text C? What is the one information text C is dedicated to? Debridement of DFUs. So debridement basically means tissue removal. So that is a medical term, right? So we have, it means debridement of DFUs. Okay, so debridement of diffuse basically means what? It means, so synonym, right? So synonym for debridement is tissue removal, all right? Tissue removal. Okay, so here it is, the text C is talking about how to remove the dead skin cells, okay? How to remove the dead tissue from a patient who's having diabetic foot ulcer, right? And now let's come to text D, right? So let's see what is the information text D is talking about. So text D is talking about the different dressings for over here. Now, as you can see, there are different dressings over here, low adherence dressings, hydrogels, alginates and all, and they're talking about advantages and disadvantages of the different dressings over there. So here they're talking about advantages and disadvantages of different dressings, okay, for diabetic foot ulcer. So what are some synonyms that we can bring over here? Okay, so dressings. Okay, so dressings basically means products, right? Dressing basically means it is a product over here. So they are talking about the benefits and cons, that is pros and cons. Okay, pros and cons of different products over here. Right. So like this, it is very important that you understand what information comes under each text over here. Right. Now, let's take a look into the very first question over here. Now, again, I just want to give you, again, there are so many strategies coming under reading part A guidance. So in today's class, I just want to focus on your intuitive trust skill, right? Your intuition developing skill, your intuitive trust skill is what I am focusing on in today's session. So here I'm going to help you to activate your instincts. Okay, that is, you have to have faith in yourself. You have to have faith in yourself. That is very important. You have to have faith in yourself and you have to trust your instincts, right? So this is a very, very powerful strategy. But remember when I told you, in order for the strategy to work, you should have a very calm and a clear mind. Okay. So only then your intuition will become activated. Right. Now let's take a look into our very first question over here. Right. So our very first question is this: how often to change a dressing? Now, what do you see over here? So here they are telling you how often, okay, that is how regularly you are supposed to change a dressing. All right. So over here, what do we understand? Okay, how often, that is how regularly or how frequently, okay, the medical staff has to change the dressings over here. Okay, to change the dressings. Now, let's take a look into each of the four text over here. Okay, so you should not forget this. Okay, so this is what you need to understand. So here the question is asking you how regularly or frequently the staff has to change the dressings for the patients. Right. Now, what are you supposed to do? Here, you are supposed to find out whether this information is in text A, B, C, or D, right? So if you believe the answer to be A, B, C, or D, you have to write the alphabets over here. So if you think the answer is coming from A over here, then you have to write A over here, right? Now, I'm going to once again come to the question, right? So the question is how often to change a dressing, right? So we have not yet read, okay? So we have not yet read the four paragraphs over here. So we did not read text A, we did not read text B, we did not read text C, or we did not read text D as well, right? But over here, the question is, how regularly or frequently the staff should change the dressings. Now, what is your intuition telling you, right? So over here in text A, they're talking about assessing a diabetic foot ulcer. Okay, so do you think this information, that is how frequently they have to change the dressings, right? So do you think this information is going to come under assessment? No, my intuition is telling it is not going to be there, right? Because text A, they're only talking about what? They're only talking about the assessment, or they're talking about how to check, how to evaluate, how to find out or supervise if a patient is having diabetic foot ulcer. Right. So my intuition is telling no. The answer is not going to be in text A. Text A is only about assessment. Here, the question is asking me how frequently they have to change the dressings. Right. Now, my intuition is telling yes, it could be in text B over here because what do you see in text B? See, dressings over here. Right. Applying dressing. So that is exactly what we are looking for. Dressings are the keyword over here, and we need to find how regularly they have to change the dressings. Right. So this thing over here. So my intuition is telling, right? So my intuition is telling that it could be in text B, right? It is not going to be in anywhere else. Now I just need to confirm. Now over here, I need to confirm if my intuition is correct or not. So let's see whether it is possible. So let's see, let's just read over here. Avoid bandaging over toes as this may cause a tourniquet effect. Use appropriate this thing and this thing over here. Avoid strong bandages, avoid tight thing, ensure wound is eliminated footnotes over here. Wound bed for in this thing. Now you see over here, what do you see over here? So here we can see that they are talking about this particular information. So how frequently you have to change the dressings every single day. See, so the question was asking us how frequently we have to change the dressings. Now see, this is exactly what we are looking for. So we have to change the dressings every single day. So that means our intuition was right. So this is how, with a very cool and a calm mind, you have to read the question and you have to rely on your instincts where exactly this information is going to be. And sometimes it may be right, sometimes it may be wrong, no problem. But you will be able to save a lot of time and energy like this, right? So now what do? You come to the answer over here and you have to write the answer as capital B because the answer is in B option over here. Right. Now, let's take a look into answer option, the second question over here. So what is second question? Ensuring patients understand the consequences of tissue removal. Right. So here, our duty is to find in which text. Okay, that is in which text, that is whether it is in text A, B, C, or D, we have to find, that is ensuring patients understand the consequences of tissue removal. This is what we need to find out, right? So over here, tissue removal, consequences. So over here, tissue removal, that is one keyword over here. And the medical staff, they have to ensure that they understand the consequence of tissue removal. Now, what was the text C over here? Now, see, when it comes to text C, what was the main heading? Debridement of DFUs. So you're all medical professionals. So you know that debridement basically means tissue removal, right? So my intuition is telling, okay, my intuition is telling that is consequences. Okay, so over here, consequences of tissue removal. It is, my intuition is telling it could be in text C because over there they're talking about ensuring patients understand the consequences of tissue removal, right? So anyway, let's just come to text A over here. So what is text A talking about? Here they're talking about assessing a diabetic foot ulcer. Okay, so here it is all about assessment, right? So you need to remember the question. So what is the question asking you? So question is asking you consequences. That is, patients understand the consequences of tissue removal. Right. Now, as you can see over here they are only talking about assessing a diabetic foot ulcer. So assessing is different and tissue removal. So there is absolutely no connection. So my intuition is telling, no, the answer is not going to be here. Right. Now let's come over here. So here, what is the main keywords that you see over here? So here the main keywords that you see is application of dressings. So here they are talking about how we have to apply the dressings over here. But remember the keyword over here is tissue removal. So my intuition is telling no. The question is talking about tissue removal, but over here they're talking about application of dressings. So here also my mind is telling no. The answer is not going to be here, right? So what I'm going to do, I'm going to I'm going to go to the paragraph which my intuition is telling could be the right answer over here. Okay, so let's see, okay, whether we can see that patients are made to understood the consequence of tissue removal. Now, see, tissue removal and debridement. So these are basically synonyms. Okay, so one is a medical term and one is a layman's term over here. Right. So my intuition directly said the answer is going to be in text C. Right. Now let's take a look into the paragraphs over here. So let's read the paragraphs. The first priority of management of the foot ulceration is to prepare the surface and edges of a wound to facilitate healing. If foot pulses are present, non-viable tissue should be removed. All right. Absent. Okay, fine. Referral to a vascular surgeon, removal of all these things. Sharp bludgeoning should be carried out by experienced practitioners. Yeah, see, for our patient is very important, right? Patient is extremely important and expected outcome. Now you see over here, expected outcome is another name for or another synonym for consequences, right? So here, consequences and expected outcome, right? Now, as you can see, that is a direct connection over here, consequences. All right. So we can send, as you can see, the patient is also in high importance over here. So here, the medical staff, so as you can see, the staffs over here, that is the specialist with specialist training. Okay. So experienced practitioners. So people who are experienced practitioners with specialist training and the plan, they should have a discussion. Okay. They should discuss with the patient regarding the consequences of tissue removal, that is debridement. So my intuition was once again right. See, this like this, even without having to read all the four texts, without having to read A, B, C, and D, the text, if you are able to just simply read and understand the headings, you can definitely save a lot of time and energy. Right. So now let's come to the third question over here. Now, what is the third question you see over here? Reasons for not choosing certain products. Okay, so there are certain reasons why we should not choose certain products. So what do you understand? So let's just understand the question. Okay, so here reasons basically means why. Okay, why we must not choose certain products. Right. So this is the question. Right. Now, in which text do you think the answer is going to be? Do you think it is going to be in text A, B, C, or D? Okay. So let's try to find out that. Okay, so for this, we have to once again come to the headings over here. Now, what is my intuition is telling? So this is what we have to find out. So we have to find out why we must not choose certain products, right? So what is text A over here? Text A is talking about assessment of a diabetic foot ulcer. It has nothing to do with products. So I'm going to say no, this is not the answer. Now, what is text B over here? Text B is all about application of dressings. Okay, but we have to find out products over here, why we must not choose certain products. So again, my intuition is telling no, it is not going to be here because there it is all about application. Now what is text C over here? Text C is once again debridement, that is tissue removal, right? So here also my intuition is telling no, the answer will not be over here. But what about text D? So text D, they are talking about advantages and disadvantages, right? So disadvantages basically means what? Why we must not choose. So that if there are certain disadvantages, then what will we do? We will not choose it. And over here, certain products over here. So what are the products over here of different dressings? Right. So the dressings are the products over here. Okay. Now my intuition is telling. So did we read all the four texts? No, we did not read A, B, C, and D. Right. So here the third question. So I'll just type it over here. So the third question was, reasons for not choosing certain product. That is why we must not buy certain products, right? So like this, you really have to understand the question, the calm and clear mind, and then we have to go to the paragraph that your intuition is telling. Now see, so my intuition is telling that the answer could be in text B, D over here, because D is all about products, right? So what are the products over here? These are the products, the different types of dressings. So all these dressings you see over here, they are the products, right? Now, the question was asking why we must not buy certain products. Now, that you can find it over here, the disadvantages. Okay, so of each of the products over here, they have certain disadvantages, and those disadvantages are the reasons why we must not buy the product. So we can say once again that our intuition was right. So therefore, the answer to this particular question is going to be text D, right? So what do you need to do? You need to come over here, and for the third question, you have to write the answer as capital D. Right. Now let's take a look into the fourth question over here. Right. So let's see what the fourth question is. The fourth question is the need to monitor a wound. Okay. So here, what are the keywords? Okay. The need to monitor a wound over here. So let's understand with certain synonyms. Right. That is the need. Why it is important to monitor, or monitor basically means what? To assess a diabetic foot ulcer wound. This is what the question is asking us. The question is asking us why we have to monitor, why it is important. Okay. See, the need to monitor. The need to monitor basically means what? The need to assess. Okay. So if there is a wound over here, why it is important, why it is needed for us to assess it. So what is your intuition telling you over here? Okay. So my intuition is telling that the answer over here could be in the in which paragraph over here. So let's that for this take over here. See here, text B over here, right? So text B is all about, no, text B over here. No, text A is all about assessment, right? So no, one second. The fourth question over here is the need to monitor a wound. Yeah. So the need to monitor a wound over here, right? So let's take a look in which paragraph it could be. Okay, so over here, they're talking about assessing a diabetic foot ulcer. Okay, so text A, they're talking about assessment over here. Now, over here, when you're taking a look into this paragraph, what do you see? You only see certain, you just see a table over here. You only see a table over here. And in the table, we have just very short information. Okay, so our duty is to find out why it is important to assess a diabetic foot ulcer wound over here. But in text A over here, they're talking only about how to assess it. Okay, here they're talking about how. Okay, so text A is talking only about how to assess. Okay, so that is if a patient is having neuropathic, then like this we have to assess. We have to assess if there is any sensory loss. We have to assess if there is any pink coloration. We have to assess if there is any bounding pulses. So here text A is all about how to assess a diabetic foot ulcer. Right. But over here, the question was asking us why it is important. The question is asking us why it is important for us to assess a diabetic wound over here. So for this, let's come to text B once again. So let's see what text B is talking about. Okay, so let's take a look into text B a little bit more clearly. Why is it important for us to assess a diabetic foot ulcer? Right, so I'm going to come over here. Let me just zoom in a little bit. Yeah, applying dressings. Avoid bandaging over toes as this may cause a tourniquet effect, and secure with a bandage. Use appropriate and take care when dressing. Avoid strong adhesive tapes, avoid tight bandaging. Do you see how ensure wound is remember that footwear needs to be accommodated. Wound should be cleansed at each dressing. Cleansing can help rebalance for infected or highly inspect the wound, okay, daily and thus every day. The different type of dressing may be the status elevation should be encouraged to look for signs. Increased pain, purulence is in some cases in the first few days, a good idea to mark the extent. All right. Now, as you can see over here, hmm, important to assess a diabetic foot. Is it the need to monitor a wound over here, right? So I must, so anyway, here they're talking about debridement and here they're talking about advantages and disadvantages. So the answer over here should be B, avoid bandaging over toes. So where do you see a wound? So here I want you to scan for the wounds over here. Appropriate techniques, avoid tight bandaging, ensure wound dead space. Cleansed. Now see over here, wounds should be cleansed at each dressing change and after debridement with the fluid sealing solution. Okay. Cleansing can help with devitalize issue, rebalance the bioburden. Yeah. Now you see over here, this is why it is important. Okay. So this is why it is important for us to assess a diabetic wound over here. So why is it important over here? Because we need to avoid these kind of things. Okay. Cleansing can help remove devitalized tissue. So we want to remove the devitalized tissue. We want to rebalance the bioburden and we want to reduce the exudate to help prepare the wound bed. See, to prepare the wound bed for healing. Now, this is the reason. Okay, this is the reason why it is needed to monitor the wound. Okay, so we have to closely monitor the wound so that and keep it very clean so that we can remove the devitalized tissue, can rebalance the bioburden, we can reduce exudate, and we can help prepare the wound bed for healing. So this is a slightly challenging question, but this is where the answer is located. So this is the reason why it is important to monitor the wound over here. So therefore, our intuition was right. Right. So we can say the answer to the fourth question is going to be, B over here. All right, so we can say it is going to be B. So once again, it is all about trusting your intuition, right? So do you think the need to monitor a wound? So do you think it is going to be an advantages and disadvantages of certain products or dressings? No. Okay. Here they're talking about debridement on that is how to remove the dead skin cells. Okay. And here they're talking about assessment. But over here, they're talking about dressings to wounds. Okay. Dressings to wounds. And see, we have the wounds coming over here. See, the same keyword is being repeated multiple times. Okay, so here the wounds, here also wounds, right? And this is the reason why we and see once again the word wound is coming. So several times the wound is repeated over here, and this is emphasizing why it is important that we have to monitor the wound. So therefore, the fourth question's answer, the need to monitor a wound, is right over there. Right. Now, let's take a look into the fifth question. How common each kind of DFU is? So kind basically means what? Type over here. Right. So how common basically means what? How prevalent. Okay. How prevalent each type of DFU is. Now, what is your intuition telling? Here, they're talking about type. Okay. The type of DFU. Type of DFUs. So, in which text do you think your intuition is telling it will be? So, my intuition is telling that it is going to be in text A. Because in text A over here, they're talking about the three different types of DFUs, right? So, as you can see, this is the first kind, neuropathic. The second kind is ischemic. The third kind is neuroischemic. Right. Now, our duty over here is to find how common it is. Now, if you take a look over here, here you can see prevalence. Okay, so is it clear? Okay, so I'll just zoom over here. As you can see, this is what our duty over here is. So our duty over here is to find how common each type of DFU is. So That means how prevalent each type of disease. So this is the first type, this is the second type, and this is the third type. And the first type over here is 35 percentage. This is how common it is. This is 15 percentage common, and this is found in 50 percentage of the population. So therefore, the answer to the fifth question is going to be in text A. So this is how you have to trust. So you don't have to read the entire paragraphs. You just have to look into it, trust yourself, and then go directly over there. Right. Now let's take a look into the sixth question. So how common each kind of DFU is. So we can say they're talking about prevalence, and therefore the answer to that is in text A over here. Right. Now let's take a look into the sixth question. How good a dressing is at soaking up fluid? Okay. So how good a dressing is at soaking up fluid? So what do you understand? What do you understand from here? That is how good, that is how wonderful. Okay. How wonderful it, how wonderful a dressing is in absorbing a fluid. This is what we have to find out, right? How wonderful a dressing is in absorbing a fluid. Now, what do you think the answer will be? How wonderful a dressing is in absorbing fluid. How good a dressing is in soaking up fluid. Now, what is your intuition telling? Okay, what is your intuition telling? So my intuition is telling over here, how good basically means the benefits. Okay, they're talking about the different benefits over here. Okay, they're talking about the different benefits over here. So let's do that. Right, so here they're talking about the advantages and disadvantages of different types of dressings, right? So advantages basically means what? How wonderful it is. It is in absorbing a fluid over here, right? So now my intuition is telling that it could be in text D. Why? Because over here, text A, they're talking about assessment. Text B, they're talking about application. Text C, they're talking about debridement. Okay, so here they are asking how good a product is, how good a dressing is. So therefore, it is not going to be an assessment, it is not going to be an application, it is not going to be in debridement. It is going to be in the fourth text over here, that is advantages and disadvantages. Right. So let's see. Let's go to the fourth text over here. So fourth text we have over here. So here you have to look into the advantages column, right? And now you have to look for the keywords, that is how good at absorbing fluids. Okay, so which dressing over here is very good in absorbing fluid, right? So it is very good at absorbing fluids. So therefore, it is important that you focus on the advantages column, right? So let's see, simple, hydro, okay, inexpensive, absorbency over here, absorbent. So this is absorbent over here, good absorbency. So here also, good absorbency, right? Highly absorbent, bacteriostatic, moderately absorbent. And here also they're talking about absorbent over here. Now see, so in which text are they talking about the, absorbing qualities of a particular dressing over here? They're talking about that in text D, right? So therefore, the answer to the sixth question, that is, how good a dressing is at soaking up fluid, the answer, it is going to be in text D over here, right? So like this, okay, you have to be able to trust your intuition. So see, we found the answers to all the six questions without even reading the four text. Okay, so we did not read entire text A. Okay, so did we read the full text over here? No, right? So we did not read the entire text A. We did not read entire text B. We did not read C. We did not read D. But even without reading each of the four texts, just by trusting our intuition and trusting our instincts with a cool, clear, calm mind, understanding synonyms, we were able to say with accuracy most of the times that the answer is going to be over here. And that is what we call as your intuitive trust skill. So it takes some time to develop, right? Trust skill. And you should have self-confidence. So for this, you should really be having your faith in yourself. Okay, so confidence is extremely important, right? And you also must have a calm and a clear mind. So if you have all these kind of things, and if you're willing to put in the effort, the practice, you will definitely find these type of questions highly manageable. And the good news over here is that you will be able to save time and you will be able to save energy as well. Understood? Right. So this is Dr. Shrikanth signing off. So those who would like to get premium quality coaching for all the 4 modules, you can kindly contact us at +91 9567674043, and you can also install our app. It is the OET Exam Mastery app. So myself, Dr. Shrikanth, and it is my absolute privilege and pleasure to help my dear students pass their OET examination. Right. So that is me signing off. So thank you, everyone. Have a wonderful day.